The pandemic isn't over. That's the message from exhausted healthcare workers across the Treasure Valley. Good evening and thanks for joining us tonight. I'm Jake Garcia. As Idaho case counts and hospitalizations remain their highest of the entire pandemic, our Karen Laird talks with doctors at St. Alphonsus about the toll it's taking on their staff.
If you're sick enough to meet me in the ICU with COVID, you have a high likelihood of dying.
That's the sad reality of the current situation 18 months into the coronavirus pandemic. Unfortunately, staff are accustomed to seeing patients die in the ICU, where a majority of beds are now occupied with COVID-positive patients who chose not to get vaccinated. At this stage, Dr. MCINERNEY says the deaths feel heavier because now they're mostly preventable.
Sometimes patients will still say, I don't care what you tell me. I still think the vaccine is a hoax. I don't even think COVID is real. And that's always hard to take.
I had a patient last week that told me that it still wasn't real and it didn't change anything that we did. I mean, we're still going to care for the patients.
Still doing everything they can to keep this number climbing. This sign greets hospital staff as they enter the building at the start of their shifts. It changes regularly, reflecting the number of COVID patients treated and released from the hospital.
The healthcare workers here, the physicians, nurses, techs, I mean, they went into healthcare to help people and to try and save people's lives. When you go home and you hear things like the virus isn't real or this is made up and people are just doing it for money, it really gets to the core of who these people are.
And that's tough to tolerate after working multiple 12-plus hour shifts a week.
The reality is a very, very burned out team.
Healthcare workers, once celebrated for their service, now feeling exhausted, overwhelmed, and demoralized.
I know the balloons and banners of 2020, that was fantastic. We don't need that now. What we need is just to hear that you still believe in us. What I'm seeing across the board, nurses, CNAs, respiratory therapists, pharmacists, physicians, both inpatient and outpatient, is that they're pushing it to the max.
If there's a case where we're all rushed in and the patient is young and we're doing chest compressions or trying to save somebody, when you close your eyes, my brain will sometimes try to reintroduce those visions over and over again. So similar to how people describe PTSD.
And still, they keep coming back day after day, only to leave work and see Idahoans who aren't taking precautions to keep themselves out of the hospital.
I guess it's just been a little frustrating because people are, not masking, they're not taking any precautions, or there's new, concerts or events that are going on that weren't there last year, which are making it a lot harder for people.
So how can you help? Listen to the experts, take the virus seriously, and thank a healthcare worker for their work and dedication during this difficult time.
If I could do anything, it's just show them that, hey, this isn't over. Like, people are suffering day in and day out, and we're trying to do the best care we can, but we only have so many resources to do that.
Karen Laird, Idaho News 6.